Good friends, I'm Dr. A.S.K. Gupta and I'm going to talk to you about the hydronephrosis in the kidney. This is the right kidney of the patient who has come to us with the pain in the loin being referred to the groin. And you can see that this kidney is seen, and this is a hydronephrotic kidney. This is moderate to severe hydronephrosis, and you can see that the upper part of the ureter is also dilated. Usually the upper part of the ureter is not that well seen, and if you see carefully you can see that there is a radiopaque shadow over here. Here you can see that there is a radiopaque shadow which is casting a caustic shadowing, and this is nothing but a calculus which has originated from the kidney and trying to pass itself into the ureter, and it has got stuck over here. Usually the obstructions will be seen at the pelvic-ureteric junction, as in this case, or in the uretero-pelvic junction, which I am going to show you in the another case. But here you can see that there is a large stone in the pelvic-ureteric junction, and this is around 21 millimeters in size. Usually the stones more than 10 millimeters will not be able to get past through the ureter, and this is a case of pelvic-ureteric obstruction by a calculus. And we should always look for the ureteric jet into the bladder, and you can see that there is a small jet from the right ureter into the urinary bladder. It means that this patient is still having right kidney which is functional, and this obstruction should be relieved as early as possible. Otherwise this kidney is going to get knocked out. But here you can see that the kidney is showing a good width of the cortical margin, which is a good sign, but such a moderate hydronephrosis in long term is not going to be beneficial to the patient, and this patient should be taken for a surgery. This is another patient where you can see that there is a small calculus around 7.5 millimeters over here. This is slightly difficult to see, but this calculus can be appreciated by seeing the comet tail effect on the color Doppler scan, and this is highly suggestive that this is likely to be a calculus. And this comet tail effect is highly suggestive that there is an obstruction here at the uretero-vesical junction, and the most common cause of this obstruction is likely to be calculus. I try to show the calculus in the grayscale, and you can see that this is a calculus around 7.3 millimeters, and it is causing an acoustic shadowing. So it is likely to be a calculus which is causing obstruction over here. And if I see the kidney, I find that the kidney over here shows the dilatation of the ureter as well as the moderate hydronephrosis, while the other kidney is normal and does not show any hydronephrosis. So this is a case which has been caused by the obstruction at the UV junction. I told you another case which was showing the obstruction at the PU junction. So these are the two places where the obstruction is likely to be there. Sometimes the obstruction can be at the junction of upper 2/3 of the ureter and the lower 1/3 of the ureter, where the iliac vessels cross the ureter. But at times it is very difficult to see, or it may not be possible to see that obstruction or the calculus over there, because the ultrasound machine cannot see at that level. But these two levels, that is the PU junction and UV junction, are accessible, and they should be assessed very carefully. I hope you like this video. In case you like it, please do subscribe to our channel and do not forget to press the like button. And if you see carefully, then you find that there is no ureteric jet from the right hand side, and this jet which is there is the other opposite jet that is from the left hand side. So probably this patient's kidney is not functioning well, and she should be subjected to the KFT and the other examinations like the DTPA scan or the CT scan, and this obstruction should be removed urgently.